Good evening, and welcome to the Caring View, the online health and social care platform free to access to absolutely everybody. Before we get started, don't forget to hit that like, give us a subscribe, and give us a follow. We are live across YouTube, LinkedIn, X, Twitch, Facebook, you name it, we're probably there. And we're also all over Spotify on your favorite podcasting channels. www.thecaringview.co.uk for all of our free resources, access to all of our episodes and content, as well as our fabulous suppliers and amazing sponsors. Everything we do at the Care and View is completely free. We're not here to charge you. We believe knowledge should be for everyone in social care, and we are just here to elevate, celebrate, and educate all things social care. And we are only free because we have some fabulous, generous sponsors out there in the world of social care who keep the lights turning, or keep the lights on, keep the wheels turning, whatever the sayings are, here at the Care and View. So without further ado, quick roll call. We have Prosperwell, the UK's leading digital marketing agency, www.prosperwell.co.uk. Do go check them out. If you know Toby from Smooth Digital or Tea with Toby, or the really just not here anymore Health and Social Care Club, that fabulous thing that used to be the Health and Social Care Club, do go check out Prosperwell. We have CBAT. Business Associates training for all of your healthcare training requirements. CBAT can provide every care training course you need. I'm not entirely sure why, but my name's changed to say that I have got powered. I'm powered by Jack AI. Mark's busy playing around with tools here. CBAT are fabulous. They have an array of health and social care courses, also high performance leadership courses. They have the fabulous CHAPS course, and they do train the trainer. And if you do think to yourself, you need breakaway technique train the trainer courses, give them a shout, because I know people are asking for it, because I am too. But we use CBAT and they are fabulous, and their training is second to none. We have Attis Care by Attis Insurance Brokers, comprehensive care coverage and proactive risk management. I should also say that the director of CBAT is sat on our screen right now. It's Elaine here. So if you've got any questions, fire them over to her. I'm sure she'll be happy to answer. Attis Insurance Brokers, James from Attis is also another helpful voice at the end of the phone. We have Log My Care, the intuitive care management platform loved by complex care providers. And if you're thinking about switching or trying out digital social care platforms for your first time, they do have a freemium version, and you can try before you buy. We have Health Automated Online and in Learning Wins Online, AI-powered training, AI-powered care planning software here. This is I'm going to say this is the future. AI is going nowhere, especially around that care planning side. So please do go check them out. Jack White, the brainchild of these two fabulous pieces of software, also is the brainchild of Jack AI. As you can see by my name, that is what our website is powered by. We have Florence, directly connecting healthcare professionals with organizations, shifts, and training. Great alternative to agency. You know who's coming. You can change. You can say you don't want them back because they were rubbish. You can say I do want them back. They're amazing, and you can favorite them. Get all their profiles, their training lists of what they've completed before they come to you. Absolutely fabulous way to manage all of your workforce needs. And last but not least, we have Every Step Care Consultancy, transforming care services with tailored consultancy, turnaround management, coaching, and compliance support. If you've missed any of these websites or any of our sponsors, do head directly over to our webpage after this show, though. Don't multitask. Lots of learnings be going on right now. And you can find all of our sponsors there, or better yet, rewatch this episode and you will get this full spiel again. Good evening, everyone. Good evening, Mark. How are you?
Yes, good evening. Not too bad, thank you. You?
I'm good. Same old. Old age and poverty. You know what it's like. I'm holding out, not putting my heat. I do have my heating on, and I do have my electric blanket going at this moment. Not at this moment in time. It will go on an hour before bed. But I'm trying tonight to not put my heating on, because I don't want. It's only September, and I can't have my heating on 23 degrees every day from now until next April or something stupid. But yeah, I'm good. It's just cold. Elaine, welcome back to the show. How are you?
I am fabulous. Apologies if I do any coughing and spluttering this evening on the back end of a cold, but always love to be here.
We will paint a cross above your door. Don't you worry. We will not come and visit. We will separate you from the population. You bubonic plague carrier. You. No, I'm joking. Elaine, for those who don't know you, tell us a quick bit about who you are and where you're from.
Okay, Managing Director of Care Business Associate Training. We are a training provider for health and social care. We're a national training provider, so we have over 300 trainers located geographically all over the UK, of which I know that some are hoping to tune in this evening, so hopefully they will be here with us. And yeah, literally we do clinical training, train the trainer, leadership and management, children and young people, all your adult mandatory stuff. We specialise in things like kind of physical intervention, restraint, breakaway. And we're here tonight because we are on the Oliver McGowan journey, and hoping to share that and learn things from my other colleague.
Fantastic. Well, thank you so much for joining us again. And again, a huge thank you to CBAT for your fabulous sponsorship of the Caring View. We would not be here without you. Jenny, welcome to the show. How are you?
Thank you. It's lovely to be back. I'm really good. All the better for seeing you guys. Thank you for having me back.
You're most welcome. You're most welcome. And we love having repeat guests. It's, you know, it's fabulous. It becomes a bit of a family here at the Caring View, and it's just so great to have familiar faces joining us. But Jenny, for those who do not remember you, tell us a bit about who you are, where you're from, and what you do.
Oh my gosh, I feel like it's a game show.
Like Cilla Black, isn't it? In like Blind Date or whatever it was.
It really is. I need to do
contestant number one. If you were a training course, what training course would you be and why? No, sorry, go ahead.
Thank you. So I'm Jenny. I'm the Director of Education at One Stop Training, and I'm also one of the owners. We are a fairly small training provider, but we do have national reach. We offer a wide variety of training courses. And one of the things that we are really passionate about is Oliver's campaign and all things Oliver McGowan. My own background is within supporting people with a learning disability and autistic people. It's something that I've practiced in that world for over 30 years, really passionate about it. And I've waited for the world to want and need this training. So I am here, I'm ready for it. And we do lots of other things as well. But tonight I really want to focus on Oliver's campaign and what it means.
Perfect. Well, thank you both for joining us. I'm going to start and then I'll hand over to Mark. But my first question is going to be, for anyone who's been living under a rock for the last God knows how many years, I'm going to come to you first, Jenny. What on earth is Oliver's campaign, and why this? What's happened? Why do we need to do this? What's going on? Thank
you, Adam. Oliver's campaign has been a long time in the making. It was a long journey that started sadly with the death of Oliver back in 2016. Oliver didn't receive appropriate care and treatment in a hospital environment, and the cost of that is that he didn't survive the treatment that was provided. There were a number of lessons learned, and as a result of that, Paula and Tom, Oliver's parents, campaigned to make training mandatory for the NHS and social care professionals to make sure that everybody has the skills, knowledge and competency to support people with a learning disability and autistic people to receive health equity, to be seen, to be validated in their lived experience, and to make sure that legal rights such as reasonable adjustments are not only honoured, but that we are proactive about it and that we actually know what type of things people might need so that we can offer instead of waiting for people to ask. And just to make sure that, you know, the guidance under the Equality Act is rolled out for all communities and not just for the communities that we see in the headlines. And I think really that's what the campaign has done, is it's really raised equity for those communities. So it's been a wonderful thing, but the cost of it was huge. And we must also acknowledge that Oliver is just one person who lost his life as a result of those types of experiences. There are hundreds of thousands of people who've been in similar experiences. So the training, whilst it carries Oliver's name and is about Oliver's experience, we do flesh that out and talk about both communities more broadly.
Thank you, Jenny. Thank you. Mark, I'm going to hand over to you.
Yes, thank you very much. Elaine, just one of the misconceptions just kind of wanted to knock on the head is, and I see it quite often in a lot of the forums, is there appears to be quite a bit of anger from some social care providers that the failings happened in the NHS and now social care are picking up kind of the pieces, so to speak. And it's not just social care, is it? It's across the board that everybody has got to do this training.
Yeah, so it has caused quite a lot of controversy, and it's a difficult one because quite often people within social care are already working with autistic people and people with learning disabilities, and they'd have had a much higher level of training than what the Oliver McGowan Tier 1 or Tier 2 is providing. So I think there's been a lot of kind of controversy with social care feeling that they need to be doing this when it happened in a healthcare arena. And obviously all of the funding initially went to healthcare with that. So it was a bit like kind of social care was the poor relation, which seems to be the case in quite a lot of things. And I think a lot of social care providers have waited before starting their journey or rolling out with this to kind of see what happens with it and to see what's going to be happening with the funding, because it has massive cost implications to social care providers. So that's certainly something that they're going to be needing to weigh up going forward.
Thank you very much. And we're going to talk about funding towards the end of tonight's show. So we'll definitely be able to support you. Well, we won't be able to support you with that, but we'll be able to support you with where to go to find that funding. But hopefully by the end of tonight's show, you'll also have some simple things that you can do that aren't going to cost your business loads of money that you can implement for free. So I guess we've touched on where it's come from. I think one of the other misconceptions is that the CQC have just plucked this out of the air, and probably not helped by a statement they did like a year and a half ago, saying that they were going to start inspecting and there was kind of no guidance or anything kind of surrounding that. But there is actually a code behind this, which is from the Department of Health and Social Care. Jenny, are you able just to talk to us about that at all?
Yeah, absolutely. So I think the code has been really long awaited. The draft code was out for a really long period of time, and it gave us a flavour of what was likely to be enshrined when the code was confirmed. I think the draft code is quite similar to the code that is now out, and it lays out very clearly what the requirements are. It is a government document, so it says very clearly that the government expects the compliance element to be there. It is a legal requirement that was actually introduced by the Health and Care Act back in 2022. The code was awaited because it really was focusing on what are the details around this, what are the elements that make it statutory, and who should undertake what tier of training. The code itself, it's not that laborious to read. You can probably read it in about 20 minutes. So although I appreciate that a lot of care providers are really pushed for time, it is worth looking at the code. It's particularly worth looking at the appendix that is at the end. I know that it's very easy to kind of read a document and go past the appendix, but if you go to, sorry, it's not called appendix, it's called Annex A. It gives examples of roles mapped to the various tiers within the core capabilities framework. And that gives really clear direction to different types of provider as to what the expectation might be. So if you couple that guidance with the CQC updated guidance, I think it provides quite a clear framework for reference. I don't know if I've even answered your question, Mark, because as usual, I've gone off on one of my own little tangents. Has that covered what you were looking for? Have I waffled again?
Yeah, no, definitely. And in the comments, I am sharing. So I'm sharing a blog that Adam and I put together around the Oliver McGowan code and bits and pieces, similar to what we're going to talk about tonight. But I've also shared that code of practice in the comments so that people can go away and have a look. And you are right. Originally, I think June 2025 it was published, but you can see there the whole history of kind of that draft there that you spoke about. Elaine, anything that you wanted to add to what Jenny's spoken about there?
I think the challenges that organisations are going to have is in particularly with Standard 3, which relates to it being the courses for autism and learning disabilities being co-designed and co-developed and co-produced and delivered by experts with experience. And I think that that's where a lot of organisations are going to struggle, particularly if they have internal teams that they may have really, really good training, which now won't comply with the code of practice because it might not be co-produced and co-delivered by experts with experience. So I think that is going to be the challenge. And I think kind of talking about CQC feedback that we are getting is quite often it's the local authorities that are questioning, whereas it's not been CQC that's gone in to say, what training have you got? It's actually been the local authority at the point of commissioning that is asking, are you rolling out Oliver McGowan mandatory training? So I think there's a few challenges ahead in relation with that. Like Jenny said, the code of practice is really straightforward to read. It's not full of loads of jargon. It's not got loads of big words in it, loads of acronyms in it. Very readable, and like you say, very understandable. But it is that standard 3 that is going to be the stick in the mud for potentially a lot of existing training providers out there that are delivering autism training and training with learning disabilities. That will be the issue that they will need to come across if they decide not to go down the Oliver McGowan mandatory training path.
Thank you. Adam, back to you.
I think, so look, for me, we definitely need to be doing training. We definitely need to be raising the awareness. It is difficult for social care. So for us, for example, we have been doing learning disability and autism training, 2 separate courses for God knows how long. We've been doing all sorts of training to be able to bring the awareness to it. And I'm not going to rant too much about it being specifically the Oliver McGowan stuff, because actually, and correct me if I'm wrong, because what we did before the code of practice came out is we had a look at what the standards were for the training before the code of practice, and we cross-referenced the training we currently did and said, yes, well, we do all of that already. All of that's already done and covered by our training. But what is it that we're not meeting right now? And is there any way in which we can bolster what we currently offer, either by doing an additional session to cover the rest of it potentially? The problem I have with it is I have sat in NHS meetings with the ICB where we've discussed this, and they've openly admitted that they don't train their team in the Oliver McGowan stuff because they're just not doing it. They don't have the funding, they don't have the access to it. It's just not something we're looking at really implementing here. And then you get your ICB inspections and they go, oh, you're not doing your Oliver McGowan training and you need to be doing it. And it's like, well, come on, pot kettle black right now, because this is for the whole of health and social care, not just a stick to beat us with when you come down and do your quality assessments on us to make sure that we can give us a contract or not. It should be parity. Like you said at the beginning, Jenny, this is around parity of health. It's around equity here. It's supposed to be making sure that everyone has full access to this. So I do worry that the NHS isn't following suit and isn't doing their part of the sort of bargain here. They're not doing their sort of work alongside implementing this like we are in social care. I think for me, the biggest issue, and I think this is what's happened when I've spoken to managers as well, is the majority of providers are elderly dementia or elderly nursing. And I think there is some annoyance that we don't have similar focus on dementia, for example. I'm a John's campaign ambassador, and I know the damage being separated from loved ones can do for just 24 hours of not having access to loved ones, and you lose functions, you lose the abilities. And we've been campaigning for it for years, and it's not had that similar sort of traction of everyone must be doing their training and it must meet these standards, because people just think you can just do a bit of dementia training. And there is a guide out there from Skills for Health, Skills for Care, and what have you, which sort of set out a tier 1, tier 2 approach to dementia. And I know something new is coming, which will be great. I just think a lot of people in social care feel like we've put all this effort into this, whereas actually there's a lot of stuff that we're currently not doing in social care where people are getting failed a lot, especially in health. My view on things like Oliver McGowan and dementia is it shouldn't be for health and social care. It should be for all public-facing roles. I think anybody who runs a taxi rank, runs a library, owns a shop, does anything like that, should be mandated to provide training to their team for dementia awareness, learning disabilities, and autism. Full stop, because we are all public-facing roles. And what we're basically saying is people only matter when they're receiving healthcare. We're saying they don't matter in society as a whole. So in society as a whole, you can still have people come into your shop and people go, oh God, it's that weirdo from down the street. Whereas actually, if we trained people... So I'm going to tell you one quick story and then we're going to get back into Oliver McGowan. This is why I believe the campaign doesn't go far enough. So I went to a Thai restaurant in Lytham gorgeous Thai restaurant, tiny little restaurant on the corner. And this we're having our dinner, and this elderly chap comes in, and he sits there and he sits down and he orders a glass of wine, gets his glass of wine, orders his dinner, gets up and goes, and then comes back in and they bring his dinner for him and they put the dinner down and then he gets up and goes. I said, was everything okay with that chap? Because he's not eating his food or anything like that. Oh, since his wife died, his dementia's gotten worse and he forgets whether he's been for dinner or not. So we always have a dinner and a glass of wine ready for him, so that when he comes, we just give it him so he can have something to eat and drink. We never charge him. But it's just nice to know that he can come and get something to eat if he wants to. And if he forgets, he forgets. It's not an issue. And I'm thinking to myself, that's where we're failing people here. It's not necessarily just in health and social care, but it's in society as a whole. And this campaign, if it does take hold and it does gain the momentum that it does need, because again, it's only as good as whether people implement it or not. And there will come a time where if no one's implementing it, they're going to go, oh, I don't know how much more money we can pump into this. So we do need to get behind it. I want it to go one step further. And I want all public facing roles to be having to deal with this type of training so that their team are aware on how to respond to these people. Siobhan, I've just seen your comment in the chat. So I'm going to also say rant over, because I very much share your views, and I do think that social care are amazing, but we are struggling. We are struggling to access this training. We are struggling to figure out what it is we require. Are we a tier 1 provider? Are we a tier 2 provider? Where do we access this training? And is our current training good enough? So I'm going to go with that one first. Hypothetically, I deliver learning disability training, and I also deliver Oliver McGowan training. Sorry, just on the code of practice as well, it is available in Easy Read. I think it'd have been a massive faux pas if they didn't make it available in Easy Read, but it is available in Easy Read, and you can get that on the government website as well. But I deliver learning disability. I deliver autism training. Can I still cross-reference the training that I currently deliver with the code of practice to see whether it meets it or not? Or do I have to do Oliver McGowan?
Can I just respond to some of the comments that you made earlier?
Oh, in my rant? Yeah, of course you can.
Would that be okay? Not your rant, in your passionate speech, which was lovely, by the way. I have to say, in the last kind of 18 months, myself and my team have delivered a lot of Oliver McGowan training. It's been the majority of our business for a really long time. And please be reassured, 90% of that I've delivered directly into the NHS. And I can assure you that that has happened. We have had all grades of staff from the NHS attend, from consultants to domestic staff to receptionists. It's been really well received. We've had some lovely reflective practice. We have seen NHS ICBs drive change in both their policies, their procedures and their practice as a direct result of training. One of the things we do at One Stop alongside the commissioners that we work with is we measure impact, and we're able to report on that at the end based on the outcomes that are reported to management following training, but also based on the feedback that we get from learners during the training and following the training. So I can't speak for all areas, but it is widely rolled out within the NHS. And I know that it feels for social care that we're the Cinderella service and we've been left behind. But given that Oliver's death took place in the NHS, we have to recognise that that's where the training is more urgently needed. However, the training content is geared for both health and for social care, and it is about partnership working, because of course we need to make sure that we know how to speak to each other, and that's really what it's about. It's about acknowledging the specialism of both roles and saying, in order to serve people well, everybody with the right skills needs to come together to lift people's voices up. So that's really what it's about. In terms of recognising that a large amount of care services serve older people, I think one of the things that's really important is that we recognise that in the learning disability today, I want to say vlog magazine online, they recently shared some research from King's College London that acknowledged that the majority of autistic people over the age of 40 remain undiagnosed, with numbers even higher in the over 60 population. Now, we know that there is a huge unseen community of older people out there who are autistic or have other forms of neurodivergence. There are undiagnosed people with a learning disability. And I think we need to think about intersectionality with the people that we support instead of looking only at primary diagnosis, because one of the things that we explore in Oliver's training is diagnostic overshadowing. And we know that where people may have a presenting condition, may it be a type of dementia, if somebody's quite far down their dementia journey, it might be quite difficult to see the characteristics of other co-occurring conditions or ways of being that they're living with. So I think it's really important that we acknowledge that just because you're an older person, it doesn't mean that you're not autistic. It just means that the time you would have been able to be diagnosed, the diagnostic manuals probably didn't allow you to be diagnosed. And that in addition to that, we were not good at recognising autism when it was masked. And we're only now starting to recognise it's not just people with a learning disability who are autistic. Lots of people are autistic. And I think given the demand for diagnosis, we have to acknowledge this is a growing area. And if you look at the cost of provision for autism, those costs are absolutely huge, and we need to do something to get in front of not only the horrific outcomes but particularly the suicide rate for the autistic population. And I'm sorry to mention that because I'm sure it's quite triggering, and if I've triggered anybody, I apologize, but we need to not hide from the stark facts. Autistic people live their life as autistic people, so we are talking about acquired trauma right from childhood that somebody carries through, and in that respect is very different from dementia, which obviously is something that somebody develops. We're talking about, as you quite rightly say, Adam, thinking about society as a whole. We need to start off thinking about children, and I know that Paula is campaigning to get this into schools. It's really important that we do that, but one step at a time. You know, we're really delighted that the campaign's opened up, and I wholeheartedly agree with you that it's not just about autistic people or people with a learning disability. There are other communities whose voices need to be lifted up. However, we've got this short period of time to talk about Oliver's campaign tonight, and it's just a real pleasure to be able to do that. I've drifted again and I've not answered the question, so please, can you remind me?
I was too busy listening to yourself, so I'm thinking, what did I ask? Oh no, I asked, can we cross-reference our training for? And I just want to add, because I'm a very open person. I always talk very openly about everything, and I never hide anything about myself. I'm in therapy, and I've been going to therapy now for like 12 weeks or something like that. And my therapist has suggested to me to go for an autism screening test. Because some of the stuff that I've discussed through my childhood, through my sensitivity, through my high response to sensitivity, to environmental stimuli, to emotion, apparently are all traits. And that she said it could benefit me for going to do it. I know that the screening is taking ages for people, and I don't want to take away from people like that. But it just goes to show that you don't even think about it yourself. And I'm not saying that I have got autism or any autistic traits, but if you sit down and talk to someone who's got experience in identifying it and they start saying, just FYI, you know, you can notice it by doing this in yourself. I didn't even notice it in myself. So if I don't notice it in myself, how am I going to notice it in my people that I'm supporting, which is where I'm presuming this training comes in to help me identify it, which will be really beneficial. But yes, I do learning disability. I do autism training. Can I cross-reference it? Can I sort of go, well, actually, we meet the framework because of X, Y, and Z, or do I actually need to do Oliver McGowan training?
So as a representative of Oliver's campaign, I have to say that Oliver McGowan mandatory training is the government's preferred and recommended form of training. We all know that.
Yeah.
However, it is also equally clear that any training that is given that is not of that model needs to meet the same requirements. And it's laid out very clearly in the Code of Practice what those requirements are. It talks about all of the areas that need to be covered. And those areas are taken from the core capabilities frameworks. And as we know, there are two, one for autistic people and one for supporting people with a learning disability. They have been around and established for a long period of time, and all good training should map to those anyway, so that people purchasing training purchase the right training for the staff group or the people that they are supporting. There is no reason why other training offers cannot be validated and accepted here, providing they meet the other requirements of the code. And as Elaine pointed out earlier, the requirements that are specific there is that they must be co-prepared, they must be co-delivered, they must be co-evaluated and co-quality checked. Now, all of our training at One Stop Training, all of our learning disability and autism training meets all of those requirements. A lot of providers have been doing that for a long period of time. I've been doing that for years prior to opening One Stop Training. The majority of our staff at One Stop have lived experience, so it's built into who we are, it's built into our model. The other thing is about the external quality assurance requirement. And one of the things that we need to acknowledge is the amount of testing that was done with Oliver's training. I think it was tested on 8,000 staff. And we cannot compete with that in terms of other models. So in terms of the quality, the national team monitor and manage the quality really closely. And if you think about how broadly it's rolled out, that is one heck of a task to do. All of us are involved in that. We all give feedback. The slides are updated incrementally. And yes, sometimes we would like updates to come a little bit earlier. We all know the new leader report is out and it's not been integrated into the slides yet. However, at a local level, we are able to add to the slide decks with local examples and local case studies and local information. So there are opportunities for Oliver's trainers to be able to contextualise to your learner group and to your local area. So you can create your own model, but it is going to be quite tricky to make sure that you can offer something that is equally as robust. If you are going to co-develop, co-deliver, co-evaluate, I actually don't think the cost is going to be any cheaper than buying Oliver's model. I really don't. I don't see a way to do it as a training provider.
So I suppose, I think that's really helpful and really, really insightful. And again, it's going to be my last grumble about it, because I know there's going to be providers sat listening to this right now who are thinking exactly what I'm thinking. If we're going to mandate a training to social care, it seems very unfair that it's monopolized to one training program with a cost rather than being able to access it from multiple providers at different. Because, like, for moving and handling, there's not one set moving and handling training course that we do. There's not one set first aid course that we do. There's not one set dementia course that we do. There's not one set any course that we do. They're all different. I mean, we do our RQFs, used to be MVQs and what have you like that. And yes, they all get similar framework and all that jazz. That's a qualification, like an actual diploma. So what is the cost? And is it fair that it feels like it's being monopolized to one thing? You know, we've got to understand that national insurance increase has gone up. We're not getting any sort of cuts elsewhere. Well, we are getting cuts. It's just cuts to funding. So social care rates aren't going up as much as we actually need them to meet the demand of care. Everything's costing us more. And now there's something that if we don't do, regulatory and contractually, we're going to face issues with our stakeholders because we're not providing it. And we're going, the cost though. And it's just really unfair that surely if it was this sort of super important, we'd roll it out for free and we'd make sure it was accessible to everyone, because for the little providers, we're sort of outpricing them out of the market now.
Okay, let me respond. I absolutely understand where you're coming from. And this is something I hear a lot when people phone and have conversations with me about this training. So it is not mandated to any one provider. There are lots of organisations that are offering Oliver's training, and there are lots of different price points.
Right.
Skills for Care have a quality assurance framework. There are quality assured Oliver McGowan mandatory training providers, and part of that quality check is to make sure that there is transparency about price and to make sure that what we are doing is equitable, to make sure that we are paying our co-trainers appropriately. There are just 13 quality assured Skills for Care Oliver McGowan training providers.
Wow.
One Stop Training is one of them. It's really important that we look at that. It's also important that we acknowledge that whilst as training organisations, we all have to make a profit. We have to survive. We are businesses. But on Oliver's campaign, we have to remember what we are doing here. So we profit, but we do not profit here. We have absolute price transparency. I'm very willing to share my prices with you now. willing to put them in the chat if you would like us to. It does vary hugely. Anybody that does a little bit of research will see that there are organisations who are charging astronomical amounts. There is clear guidance around the amount of people that you can have in a cohort. So we offer to train up to 30 people. So whilst the training itself is quite expensive, actually, when you compare it to a sized cohort for other training, which might be capped at something like 16 or 18, you're almost double. So actually, per head, it works out reasonable. On top of that, there are a number of different offers. So you can attend open course where you buy one place or you buy a few places if you need to top up. You can have a closed cohort. And for smaller providers, we've got Facebook and LinkedIn groups where smaller providers collaborate and split the cost of a cohort. So it's really difficult getting your staff off the floor to attend training, but there are ways in which we are working to make it as accessible as we can. Personally, if somebody comes to me and they are from, Liverpool or somewhere miles away, I'll say to them, I can give you a quote, but I can tell you now the travel cost is going to make it very expensive because I have to get a trio there. I also have to think about safeguarding and making sure that my team travel safely. That is expensive. I will always say, this is my cost. I suggest you look for a local provider because they may well be able to offer it at a lower rate. Here is a link to the national providers list. It's really important that we don't start thinking about, I want all the business for my organisation. That's not what Oliver's campaign is about. It's about making sure that the story is heard and that the change is driven. There is some funding that's going to be available, and I know we're going to talk about that a little bit later. We still don't know quite how much it's going to be, but there is going to be funding that supports that. But it's best to start booking it now because we know that the funding at the moment is only agreed for a limited period of time. So let's not sleep on it.
Thank you very much. Want to touch on the tiers of training, but just before we do, I've shared it in the comments and I mentioned it earlier just about our blog. It does talk in there about how you can map against the code. So some simple things you can do. There's links into the frameworks, and there's two frameworks. There's one for learning disabilities, one's for autism, and it talks about and it guides you through how to audit your current training against that code. Things to look out for. So like Jenny's spoken about, is it co-produced? Is it co-delivered? Can people interact? Record keeping, bits and pieces. So there are some tangible bits that you can probably start doing that are free or a lot cheaper than obviously diving straight into training. Just want to talk about the tiers, and I'll bring you in, Elaine. So I'm a re-enablement provider. I'm going to use my own organisation as an example just to help kind of with this. So we predominantly support anybody over the age of 18. Generally speaking, we don't come into contact with people living with a learning disability and or autism. But we might, because obviously most people direct through our service. Or it might be that I'm a home care company and predominantly private, supporting older people living in their own homes, or I might be a care home for older people. Again, none of those have a diagnosis. So you've got tier one. Are you able to talk to us about that? But also, do we then need to do tier two if we know there's nobody that we're supporting right now in our service living with either of the conditions?
Okay, so on your first point, obviously tier one, for people who might not be as familiar, is the 45-minute e-learning that you do in both tier one and tier two, and then the 1 hour webinar that you do with tier one, that is virtual in relationship to that. And kind of feeding into your second bit, what the regulators are asking very clearly in the code of practice is about making it a training needs analysis based on the staff roles linked to the capabilities framework. So if you currently do not have anybody in service, then I would be saying the tier one. And then when you did get somebody in service, then your staff would then need to be doing the tier two. But it's very clear in the code of practice that it is it's about being needs led on your staff currently, and the kind of support they are providing.
Thank you very much. And that tier one is free to access, isn't it?
The e-learning is free. The 1 hour webinar is not free. And again, like what Jenny was saying, there is a huge disparity in costs, and you don't have to look very far online to learn it is very different. And that's something that I think kind of, you know, is going to cause issues where people are like, well, actually, it's exactly the same training that, you know, Joe Blog down the road is doing, but they're charging twice as much. What's the difference with it? And so, you know, I think that's going to cause its challenges, because even with tier 1, it's still a live webinar. So there's still your trio, which is made up of your autistic person, your person with learning disabilities, and your co-trainer. So you're still paying 3 people's wages. So, you know, there is obviously a cost to that. Obviously, the tier 2, I know you're probably going to go into that in more detail. We're at just the start of our journey with tier 2. I'm very interested to learn from Jenny's experience. So we've got our kind of our trios, and we have had a lot of support from one of the providers that we deliver training for, and they have assisted us in recruiting and supporting for us to train the people that they directly support, which is amazing. So at some point I want to come to the benefits to the experts as well. That's something we've not necessarily touched on yet tonight. And so the challenges then with the people that we're directly supporting, then going from, you know, if you think a classroom of 30 people, even the 1 hour webinar can be delivered into 30 people. And, you know, you think you've got a person with learning disability and an autistic person, and they're going to be kind of on little screens with everybody, and there's 30 of them. So from our point of view as a training provider, we've made it very clear that the welfare of the experts to us comes first. So, you know, if 30 is too much, we will reduce it, because that might be too overwhelming. So then we're now starting our journey with the tier 2. We're about to take our training in the next couple of weeks with it. And logistics is a challenge. I am not going to lie. Logistics is a challenge in getting the people who were on our tier 1 to be the trainers for our tier 2, but they're all kind of geographically all over the place. And there's a massive support issue in getting people to the place, if there's overnight stays involved, if they've got allocated a one-to-one with a support worker. So that all needs to take into consideration. And I'm sure Jenny will be able to kind of enlighten us further with that. Like I say, we're just at the start of our tier 2. But for tier 2, it's a 1-day face-to-face training. So you are paying 3 people for the full day as well. So when we look at it from a cost point of view, you're paying 3 people's wages. Does that answer your question?
Yes, thank you. And I'm going to bring Jenny in to talk about tier 2. We've just had a question which might then kind of help some of that answer that you give, Jenny, which has come from Stacey. Sorry, do we definitely need tier 2 training for residential care home for the elderly? We currently do not support anybody with autism or learning disabilities. We use ELFH free NHS training for tier 1 currently. So talk to us about tier 2. Who needs it? What is it?
Can I just come in quickly before you do, Jenny, just on that question? Because where's that question gone, Mark? Where's it gone? So, Stacey, I'm going to see if I can get this right now. You're not currently doing tier 1. You're doing part of tier 1. The full tier 1, you still need to do the online webinar, if I'm correct from what I'm hearing. Because we too, and this is going to be an additional question to me, for me. So, Mark, you finish your question in a second, but is there an easier way to access them through the ELFH? Because, oh my God, trying to manage that for a full organization and all their logins and everything like that is incredibly difficult. So if it's only available on the ELFH, absolutely fine. I just wondered if there was other options available out there to access that e-learning. And then Mark, your question. And also correct me if I'm wrong for Stacey.
Should I respond?
Yes.
Is that okay? Lovely, thank you. Sorry, it's awkward in a virtual space, isn't it? My understanding and my belief is that it is only available on that platform. Okay. However, we've created video guidance around how to access it. So if you'd like us to share that, it's free for everybody.
It'd be great if you could.
Happy to do that. A lot of providers have integrated it into their training system so that you can just go straight in. There is a bit of a, I don't want to use the word faff, but you know, you have to create an account and a password and all the rest of it, but you can access it once you know what you're doing. It's fairly easy. The most difficult thing is locating your certificate once you finish the e-learning, because it goes into your account and it doesn't immediately come to you. So do have a little look out for that. In terms of who needs to do tier 2, I think it's really important that we go to the code of practice and look at what's in the annex, because one of the examples there talks about care home staff, and it doesn't stipulate, it talks earlier within the guidance about your service does not need to be supporting autistic people or people with a learning disability for you to do this training. You have to think more broadly than that. So it's certainly not limited there. Secondly, we have to recognise that just because people aren't aware they're supporting autistic people or people with a learning disability, nobody can say we don't have anybody with those needs in our services, because we're talking about hidden disability here, and we know all of those challenges there. So the first example, example 5, given in the code of practice, and I'm going to read this out. Care home staff are likely to need tier 2 capabilities so that they can make their service accessible to current and potential residents and visitors who are autistic or have a learning disability or may be undiagnosed. So it's very clear within that we're not just talking about people that use the service, we're talking about visitors, and we're talking about undiagnosed population. Example 6 relates directly to domiciliary care, and it says, in a domiciliary agency which is frequently asked to provide support for people at short notice, all staff who have contact with the public are likely to need tier 2 capabilities so that they are ready to support somebody who has a learning disability and autistic people. So I don't think it's clear cut, as in if your service doesn't provide a service right now for people with a diagnosis, or you suspect there's a diagnosis, I don't think it's that simple to say we don't need tier 2. I think we need to look at the service provision. I think we need to think about what training you've already got, and it needs to be holistic. One of the other things that I think maybe people are not aware of is it's not just the training requirement. The code and CQC specifically talk about, let me just find this, the follow-up activities that you need to undertake as service leaders to make sure that the knowledge is available. So it talks specifically, first of all, CQC say we're not going to specifically tell you how to meet those learning requirements. In the same way with other training, they don't create a list of mandatory training. They say it's for providers to decide that for themselves. But it says again very clearly, the CQC guidance, you must ensure that all staff receive training in how to interact appropriately with people with a learning disability and autistic people at the appropriate level to their role. Staff must receive appropriate supervision in their role to ensure that they demonstrate and maintain competence in understanding the needs of people with a learning disability and autistic people, including knowing how best to support them. And it talks about things like peer supervision, it talks about team meetings, case studies. So it really is about measuring learning and making sure that that is translated to work in practice. So it's not just about having a tick and your Oliver McGowan certificates on your training matrix, because that will not be sufficient.
So I'm not going to lie, this is ridiculously ambitious. And I'm saying this as a social care provider because we also need to do that for every other single mandatory piece of training that we're doing. And this is, I can feel it from the providers. It's like I'm sensing them saying, how do we manage this? I'm a residential, 80% of providers are single providers. 80% of nursing homes are single operated or very, very small SMEs. And they're thinking to themselves, don't have a training team. We don't have this. We don't have that. How can I, as a manager, do all these competencies, train all my team, do all these peer supervisions, and also run my service? Because it is becoming incredibly, you can understand why providers are shutting and you can understand why providers are closing, because it's becoming sort of unobtainable. And it's a worry that it's being made to be like the code of practice is here now, and that's great and everything's sort of there, but no one's looking at the impact assessment on providers. No one's looking at the impact of time. No one's looking at not just the cost of delivering the training, but the external the extra costs of backfilling time. me as a manager having to go around and do those competency assessments and the time for having those supervisions, when actually we need to do supervisions about everything else, and also having our team meetings, but also making sure people get to live a life. Because at the minute, all our team are going to be doing is training. They're not actually going to get time to care.
Can I respond to that? I absolutely agree. As we have been doing with safeguarding for a long period of time, we know that we have to look at safeguarding adult reviews. We know we have to check in supervision that staff know what the processes are and make sure that people know about freedom to speak up guardians. So for me, you can almost put these two together. If I were a home manager, I would be looking on my local safeguarding adults board. I would be looking at SARS, where people with a learning disability or autistic people have been let down. I will be coupling together safeguarding and the competencies around lived experience for people with a learning disability and autistic people. If you have a good training provider, they will help you in providing you guidance and resources. Any training provider worth their salt will provide IAG pre and post training. We do it as standard. I'm sure other organisations will do similarly. It's really important that we have learning partnerships these days, and we recognise the stress that's put on services. Those of us that run training organisations, and I can see that Elaine is my sister under the skin here, nodding away. This is our bread and butter. We have the time to create the resources. We will take the weight out of this for you. And yes, you have to physically roll it out, but in terms of the prep, in terms of measuring impact, we can do all of that. It's standard these days. So you're not alone, guys.
Sorry, Jenny. I think it's also about kind of having an action plan. So going back to kind of Mark's question in relation to if there's nobody that's identified at the moment, although fully take on board what Jenny's just said with the hidden disabilities, I think it's about kind of it being manageable and it being part of an action plan that, you know, should CQC come in, you could be saying, well, actually, this is the plan we've got already with our training provider. We're doing everybody with tier 1, parts 1 and 2, not just the e-learning. We're doing that, and because that's kind of, we do it, you know, so everybody has that awareness, and then we are planning to roll that out. And I think because from a cost point of view, that yes, there's funding that we're going to come to, but I think it's about, you know, people are kind of coming to us, and they're probably coming to you similar, Jenny, and saying, we didn't factor this in our budget. I've got no money for this. I've already done my budget for this year and for next year. And where am I going to find all this money? So it is about kind of action planning and having a clear rationale, like it says in the code of practice, for why you are delivering which training at what time. I think that's going to make it more manageable. Because there absolutely is, you know, we don't know if the people we're with every day have autism or who have learning disabilities. So, you know, that's why it is so wide. But it's about kind of saying, taking the panic away from providers to say, let's actually, you know, like Jenny was saying, a training provider worth their salt will spend the time to sit down with you and be able to say, right, what's in your budget? Okay, what are you doing already? What e-learning are you doing? Are you doing any blended learning? What are you doing with your competency assessing? And it being a holistic training review, looking at all of those areas, rather than just coming in and they're panicking, going, we've been told we've got to do this. And it's like, actually, let's make it easier for you to be able to deal with that.
No, definitely. And I think that's some great advice there about mapping to what you've already got. Because I think then if the CQC inspector walks through the door tomorrow, at least you can say, actually, you've read it, you've digested it, you've watched tonight's show, you've read the blah, blah, blah. But actually, right now, we're not doing it. But this is what we're doing already. And it might be that you're delivering an in-house learning disability session. It might be that you've already done autism e-learning training or something. What you're currently doing versus what you've got in that roadmap to come. And I don't think, you know, I bet not all the CQC inspectors and inspectors by experience and bits and pieces, I bet they've not all had this training either. And I think all they want is reassurance that you've got something of a plan of what you're going to do. So they have stated in one of their blogs that they're not going to tell providers or managers what they must deliver. But what they have said is they will be looking for providers to demonstrate that they are compliant with the requirements of the regulation, have mitigated the risks of staff that aren't trained. And I think, you know, if you have got staff that aren't trained, think about what else you can do. And, you know, Jenny, Elaine, Adam, spoken about it already in terms of utilising some of those resources that are already out there in the safeguard. Could you get a safeguarding person from your local authority to come in and just do a quick lessons learned in a team meeting? Could you pull some information and share it kind of in your team meeting via your communication channels? So again, there's a huge piece of work, and we're undertaking it in my service as well. Anything else on training before we move on? I'm very conscious that we are likely to overrun. It's got to be refreshed every 3 years. Sorry to be the bearer of bad news there, but it does have to be refreshed.
Social care turnover as well, because we've got to take that into consideration. I feel like I'm being the Debbie Downer on this tonight, but I feel like, as much as I want to be super positive, and for Paula and everyone like that, it's we've done work in the past there around the Oliver McGowan stuff, and we've had Paula on the show before, haven't we, Mark?
She's been on the podcast.
Yeah, and I think it's wonderful, and I think it's great. I think sometimes I just feel like I need to be the voice for a lot of providers who watch this, and I just think to myself, all sounds great in theory. I just think the rollout has been very poor. I mean, I remember trying to get the e-learning from ELFH to go into our LMS, but it's an archaic form basically of e-learning. So a lot of new e-learning platforms will use like SCORM files. So there's no way that I can actually bring that from ELFH to put into my LMS to then monitor it and manage it. I've had to set up all of our organizations. I can control and can see all my organizations, and I can do it that way. But I'm now juggling multiple learning platforms for one additional training course. And I just feel like it should just be made available to learning providers. So let's say I'm an e-learning provider. I can pay to have this course, and I can then include it into our repertoire to be to give to providers, because I just feel like it's not as accessible as it could be. I think for the work to do to actually get to access it and deliver it, it's sort of outweighing at the moment. And I also worry, and I'm not saying that this is the case, but I also worry there's going to be providers out there who are going to be going, this is 100% too much hard work. Like, this is way too hard work. The minute we identify somebody who has got learning disabilities and autism, we are going to say we cannot meet their needs because we cannot provide this training. We are going to say we can't meet their needs. We're not going to provide this training. And then I worry about how we're trying to create a parity for care, and we might create further division, because you do have to let the CQC know if you are you put it as a sort of service provision, learning disabilities and autism. You say that you're providing care for those people. So realistically, by our statements of purpose, we could say actually we're not able to meet these people's needs. And I worry that there will be people out there now struggling to find placements because providers are going, sorry, don't provide that training, can't afford it, can't access it, can't do it, can't deliver it. And I would hate for it to create a division rather than bring the actual parity that it deserves. And this is not me saying that it's wrong. I think it is right, and I think we should be doing this training. I know I'm being a bit of a Debbie Downer, but I just have to think pragmatically in the devil's advocate of, great, it's all accessible, these providers can't afford it, we're outpricing it. Are we then going to limit the amount of providers that can take on packages of people who are living with learning disabilities or autism or both? A bit like how providers will say, we don't take behaviors that present as challenging. We don't take dementia. I just see this sort of becoming something more than it needs to be because of the way we've approached the rollout of the framework and the training. I'm hoping I'm wrong. I'm hoping that we learn lessons quickly, and I'm hoping that it becomes a lot more accessible, a lot more quickly, and that more people can actually utilize it. But yeah, it is just a little bit of a worry for me. But I've made about 1 million notes, and I'm going to rethink my entire strategy against this over the next couple of weeks, because I don't like to be beaten.
Can I respond? Because I really take on board everything that you've said. What I will say, shop around for the price, because it varies hugely. Our base rate per head, Oliver McGowan, is cheaper than the majority of the rest of our training, because we don't take up to 30 on the majority of our training. So person to person, it's cheaper per head.
And so that's fine if you're a large organization. I can't release 30 people to go on one training session.
No, but you can collaborate. You can say, I can release 5, find other organizations that can also release 5.
That's the point.
It then brings the cost per head down. And there are also open courses. There are open courses all over the country. Tier 1 is far easier because it's online, so that can be accessed from anywhere. The Tier 2, admittedly, it's in person, but actually providers need to collaborate and identify what areas of the country is it not available in, and how are we going to support those areas. And I'm sure that there are a lot of organisations, including Elaine's organisation and my own organisation, that are doing our best to reach those areas. It's important that we have a number of different options available so that smaller providers are not left out. And it's about finding the right training provider who's going to link you in with other small training providers in the area, so you can split the cost and you can juggle how many staff can I have off the floor today. But it doesn't have to be backbreaking in terms of cost. And do remember, the funding is coming.
So we're going to go on to funding. Have we spoken about funding? I feel like my brain is frazzled. But I also feel like this is something the care associations should be getting behind. Because if you think about it, the care associations could have a hub where it's like, right, we'll notify you of all the sort of shared training that's going on. These people have got this booked. There's like 5 places left still. It's going to be costing you this much. I'm saying this with envy because we don't have a care association in Lancashire. We are trying to put one together, and I'm trying to do the work alongside some amazing colleagues to get that working. But I'm now thinking in my head, how do I make this available in my local area, and how can I connect other care providers to deliver that tier 2? Because it is super important. We know it's super important. We know we want to make it accessible. I know there's 850 providers in the Lancashire and South Cumbria area, and I know most of those are going to struggle financially to be able to access it. So how do we as providers, without those networks, set it up and get it involved? I'm going to attend my next I'm not a registered manager anymore, but I'm going to attend the next RM meeting in our local areas and start talking to managers there to see if we can put something together, because that's a fabulous idea of doing that bulk training and sharing it across. Food for thought. Thank you.
Yeah, I definitely think speak to your local authorities if you've got a quality team. So I know I obviously work across 3 different local authorities. In Essex, they already offer that for providers and they're funding it for providers. So definitely something that if you're in Essex, you can look at. In the London Borough of Havering, they're doing just exactly what you just spoke about in terms of pulling together providers, networking to share the costs, share the staffing. The other one, I'm not 100% sure, but definitely going to look into it. But yeah, definitely impose that idea to your Skills for Care area rep. You can find them on the Skills for Care website and take onus yourself for them to plant that seed and for them to then take that responsibility for all of you. And if you pay for a care association membership, reach out to the membership, because they're always looking for ideas of what you can do to implement it.
I'm part of one in Midlands, so I'm going to talk to them. But I'm also delivering a session to managers on Thursday around all sorts of things in social care. I'm actually going to approach this topic with them and see how many people in that meeting would be willing to share a tier 2 session and actually get something started in Leicester, because that's where one of my nursing homes is. You've inspired me to try and get this working, Jenny. I can't be beaten. I won't be beaten. This is going to work. We're going to get this done.
And it is working. It is rolling out. It is working. We are seeing change. It's a great thing. We just need to make sure that everybody knows how to make it accessible. We have got Facebook groups, LinkedIn groups that connect smaller providers together. So we are doing everything that we can as a training provider to make it accessible.
Just before you come into Mark, Paula has said that she can see there's a lot of misunderstanding. There are far more ways of making tier 2 of Oliver's training cost effective. 100% we're learning that tonight. And again, I think that approach is something that is going to be interesting. I will feed back to you all about how I get on with it.
Right.
Elaine, you're on mute.
Elaine.
Penny in the jar.
Sorry, it's because I was coughing up a long.
Well, inflation, a fiver in the jar.
I know. I think there's a lot of collaboration amongst training providers as well. I know I'm certainly working with a couple that we're building a network up. We've got to remember at the heart of it, why are we doing this training? And I think that, yes, there's logistical issues. There's, things that keep me up at night when I'm trying to put all these things together. But we've got to remember what the purpose of it was. And if you think how Paula has fought to get this into place, and next year it will be 10 years since Oliver sadly died. And that's how long it's took to get something like this in place. And I think we have to kind of appreciate that, you know, for it to have this huge rollout, there's going to be teething problems, and we are learning all of the time in relation to it.
I'm actually thinking in my head, how good would it be if we could get training providers to work together collaboratively and put together a subscription model where providers would pay for, I don't know, X amount of money a month, and they could just constantly train their team with the turnover. And, you know, you could say, like, if we get this amount of providers do it, we will be able to provide up to 70, 80, 90 places a fortnight or a month or something like that. And you could just book your team onto it, because then you don't have to worry about the cost per head, because you're just paying a flat fee and you can just get your people on it on a rolling basis. My brain is whirring now. I don't have the time to set up a whole organization, but I am thinking now of how do we get this working?
Elaine or Jenny are going to steal that
Paula,
business model.
Yeah, Paula said it's 9 years in November since Oliver died. It's been a long time.
So I want to talk about funding. And then after funding, I want to talk about one thing that we would all recommend that a care provider manager can do tomorrow when they're back in the office, something practical that they can action. Jenny, I'll come to you first on funding and then bring you in, Elaine, afterwards.
Lovely. So I'm just going to summarise as briefly as I can, because we still don't know how much funding is being offered. Funding has been confirmed for any training arranged between April 2025 and March 2026, and we're expecting that the funding amounts will be announced this autumn as per a press release from the DHSC. If you want to be eligible as a provider of adult care, you need to have an account with the adult social care workforce data sets, which I'm sure everybody is familiar with, and eligible training courses and qualifications must be paid for before reimbursement can be claimed, and proof of payment must be provided to support each claim. That's pretty much it in a nutshell at the moment. So we're at a point when we know there's funding, but we don't know what that's going to look like.
Thank you. Elaine, anything you wanted to add to that at all?
I think in relation to that, I think it's very much about, you know, as CBAT, we are more than happy to, you know, have a phone call. I'm more than happy to put my email address and my phone number in the chat to have training reviews with people and to look at what they've got, what their provision is, how we can help. And we're doing that kind of free, because we want to be, there is a lot of confusion, and we want to be able to support people with, you know, getting off the ground running with it. You know, I've seen Paula's put in the chat in relation to doing Train the Trainer. That's what we're doing. But there is a huge investment that is gone into that, again, other providers might not be able to afford to do that. So I think that's kind of, you know, just worth noting as well. But there are, you know, absolutely loads of ways that, you know, Jenny and myself can help people in, you know, for how to even get off the starting block. You know, there is a bulk upload as well with the e-learning for health, and they do give guidance for that. So that might be a help for some people. So it's just to get people started on their journey, and a commitment, I think, to be saying, you know, yes, it's challenging, but we need to be doing it. How can we do it? What's the most cost-effective way of doing it? And when do we start?
I'm really intrigued by this train the trainer option, because now my brain is going into overdrive, and I'm thinking to myself, if we could invest in some providers to do the train the trainer course, we could peer support each other in delivering some of that training. And if some of our people whom we said, literally, I'm like this, and I'm trying to Google frantically where to find these train the trainer courses, and I can't find anything.
The answer: I've got one running tomorrow, tomorrow, and the next day. It has to be delivered by a lead trainer. Facilitating trainers can't deliver it, so it has to be delivered by a lead. I'm a lead. We are delivering tomorrow. Open course in Potters Bar. They run regularly. If you look on Eventbrite, you will see Train the Trainer options available. Again, look around, because they can be very expensive. There is a maximum size to the cohorts, has to be co-delivered. So all of both days are co-delivered. co-delivering tomorrow, one of my autistic colleagues and one of my colleagues with a learning disability. At the end of that, people will be qualified to facilitate. We'll support with sharing things like systems and processes, our lessons learned, because as Elaine's talked about, there are logistical considerations. We can learn a lot by sharing best practice around that. We do need to think about mindful recruitment, and we need to make sure that we think about how we can adequately support people with lived experience on their co-trainer journey. But it's been successfully rolling out for a long time now. There are lots of amazing co-trainers around the country. And whilst we do need to be mindful of overwhelm and those kinds of things, I can tell you, my colleagues with lived experience are extremely resilient and have built that resilience up, having been in front of wonderful candidates who've been really grateful for their insight and their feedback. They've been met with nothing but respect and joy. So it's a lovely model and it does work.
So that's the hardest nut to crack here, is making sure that we have people with lived experience to be able to join the trainer. Oh, Paul, I'd love to know which ICB are giving it away for free, because our ICB pretty much charges for contracts, let alone give us anything for free. I'll try and ask our ICB whether they're delivering it. They've just dissolved our social care training hub. They've just taken it away. And this is the other thing we're facing as providers, is we are losing so much. You know, with NHS England up in the air, Quango's being targeted left, right, and centre, Reform doing whatever they want to do, we are finding so much disappear from the social care hemisphere. And one of our things that sadly we lost in Lancashire and South Cumbria was our training hub. Gone overnight. It was so sad, because we were putting together a trainer program for Lancashire and South Cumbria where providers would be able to train everybody on everything, clinical, non-clinical, Oliver McGowan, it'd have been everything. But it's how it's like 8:45, and I don't want to drag this on too long, even though it's really interesting and inspiring. I'm going to set up a trainer program, theoretically, hypothetically. What is the best way for me to go out to find people who will be able to support with lived experience without making them feel tokenistic? Because I want them to be an integral part of this training, and I want them to be the most important part of this training. But how do I go about that? How would I go out and get that? I mean, I can't just go online and say I'm looking for people to come into work in my business who have got learning disabilities. I don't want to label them, but I want to make sure that I'm finding the right people to come and support me. Are there charities out there that we can get in touch with? We'll pay them, obviously, because their time is not free. They have to be paid in my eyes. I don't care what other people say. They would have to be paid because it's their time. But what's the best way that we would approach this in the most ethical and kind way?
Can I respond?
Have I worded that horribly? Do I sound like an absolute rancid person?
Not at all. Not at all. I think you're right. I think we do need to think about the recruitment process, and we need to think about how we adjust the recruitment process so that it's inclusive for people with a learning disability and autistic people. So the first thing we have to do is think about how do we get to those people. You can look on LinkedIn. You will find people on there who are freelance and are willing to collaborate with you, but they may not be based in areas in which your facilitators are based. So you do have to think about the geography of that. One of the things that we've done is linked with local organisations. So we've worked with our local job centres. We've worked with our local authority who specifically have a department that support people with a learning disability and autistic people to find jobs. In addition to that, I looked to my own local networks, and I also directly reached out to the supported living services and residential services within my local area. We were really successful with recruiting co-trainers. I also linked with our local college that has SEND provision, and I attended one of their open days for college leavers, and we recruited really successfully through there as well. It was important to me that people with a wide variety of support needs, abilities, age, range, protected characteristics were representative. So we've got a very broad mix. It's important to get the process right. And in terms of recruitment, every person that we bring on board, we recruit differently. It's important that you liaise with that person around what is useful for them and what onboarding and induction looks like for them, particularly in terms of things like interview questions. One of the most successful things that I did is when I go to meet people is I go in the outfit that I used to wear back in the day when I was a support worker. So my t-shirt, my jeans and my DMs. I don't go in looking like a care professional. I go in looking like a person because that's who I am. And when I work with my co-trainers, we really practice that allyship value of yielding the floor. So it is all about platforming the voice of people with lived experience. Co-trainers should be able to deliver as much of the training with support as they feel confident, comfortable and able to. And we make sure that people's lived experience is central to everything we do. So as we are delivering the content, our co-trainers are constantly feeding into that, sometimes leading group discussions, sometimes sitting in the group discussions, sometimes facilitating. There are times when I stand back and try and become part of the wall because actually I'm not needed. I'm just there for if somebody needs me or if there's a technical issue and those kind of things. But it's different for each co-trainer. So we have to throw away this model of recruitment and onboarding, and we have to make sure that it is about the individual, because lots of people have lots of co-occurring other considerations. I've got a fair few co-trainers that I work with who, for example, are dyslexic. Reading the slides is a challenge. So there is no requirement to read. That's not part of the job for that co-trainer. There are plenty of other ways that people can use their voice and share their experiences. We've got some really big characters. It's the lived experience stories that people take away from Oliver's training without a shadow of a doubt.
Mark, I want to put a directory on our website of trainers across the country who'd be willing to help out social care providers.
Do it. Do it.
I think if there are people, you know what we're like at the Caring View. We can't be saying we're going to charge people for doing stuff. But if there are people out there, contact us. If you're watching this and you think, actually, I'd be happy to do this. I'm a trainer and I'd be happy to help out some local providers in my area. Let us know. We'll get you on our website and people can then contact you. I'm not trying to do any training provider out of business here. One of them's our bloody sponsor, for crying out loud. I don't want to do them out of any business. But there's umpteen different training courses out there. And I'm just trying to think of making this as accessible as possible. If there are anybody out there who is currently a trainer, who is also already delivering Oliver McGowan, who wants to help out local providers discounted or free, whatever you want to do, however you're going to do it, if you can bring people into your own service to add on to your training and deliver it that way, let us know. We'll get you on the website and we'll get a page dedicated to people who can support with Oliver McGowan training. If there's anything we can do to bring this cost burden down and to make it more accessible to anyone, we will do. And again, I'm not trying to. I only have so many hours in the day, and now I'm thinking like on overdrive how I can make this work. It's really
that needs to be factored in with that is the support element for your co-trainers, your experts with lived experience, and the amount of support that some might need over others. So I think people equally, it's not as simple as saying, right, oh, that's it, I'll go on a trainer course and then everything will be sorted. We've been on the journey with our experts since November last year, and it's been an incredible journey. But they've needed support, and we've needed to make sure that we have the infrastructure in place in order to be doing that. And so it's about those things that people need to be factoring into it as well.
Yeah.
It's great to see Paul is saying in the chat there, you shouldn't be paying extortionate fees for this. And that is absolutely right. Really important that there is transparency around fees and that there is a breakdown of if there are additional costs due to travel, due to hotels, if people are traveling a long way, that we are transparent about what those costs are, and that we are directing inquiries to local training providers to keep the cost down. There is enough training opportunity out there for everyone. It's not about profiteering from this. It's about making the training accessible and good quality.
I was just going to go to the comments quickly. So Paula has said MinCap are running train-the-trainer courses. Also, interestingly, something for all providers to do. ICBs have also been running trainer for free. There was a comment from Paula saying that well, unless I imagined it, that there's been funding allocated to ICBs to do it.
Yeah, I'm interested in that as well. My mission tomorrow, alongside doing everything else in my blooming job, is to find out where that funding is and see what they're doing.
Yeah. So all of them have been given government money that can only be used for Oliver's training. So definitely reach out to your ICBs, to your local adult social care teams to contact them and network them in. There's so many comments. Nice one for you, Jenny. I wish every employer was like you, Jenny, as not all are inclusive in terms of learning disability or physical disabilities. There was one question, but I can't find it. But when I find it, I will bring it up. A couple of people talking, Adam, about happy to deliver some training. Probably also worth looking at whether your local authority either have a contract or subcontract inclusive employment. Just thinking about what Jenny was talking about. I know MenCap do. If anybody is in Essex or West Sussex, the organisation I work for has a inclusive employment part of the business. More than happy to network you in.
My council are reform. They don't believe in EDI.
Right. Let's wrap things up. Okay, let's do a round robin of one piece of advice that a provider can do tomorrow to get the ball rolling. Something practical, actionable that we might not have spoken about already. Elaine, do you want to go first?
Read the code of practice, get a better understanding of it, and research. I know that was two. I got a couple of sneaky ones in there, but they went hand in hand.
You can definitely have more than one. Jenny?
It's difficult to pick just one, but one of the things that I would do is really look at the local safeguarding adult reviews in your area. Look for SARs that focus on outcomes for people with a learning disability or autistic people. Bring that back to your team. Look at the lessons learned and think about how that might apply to your setting, or how you can evidence that that wouldn't apply within your setting. It's free.
Adam?
I would say do sign up for LFH, because although it can be a little bit difficult, if you're a multi-site organization, you can set it up so you have access to all your sites. You just set one as the parent organization and put everyone underneath. Yes, it can be difficult to find your certificates, but you can also generate a report for a specific training course to see whether people have completed or not, and you can manage it that way. Maybe I was being a bit dramatic earlier when I said it takes up so much time. It does take time, but you've got to, it's free. Do your part one of tier one through your LFH, and then have a look at who's delivering those webinars and whether you can get yourself onto them. But if you are part of a care association, or registered manager networks from Skills for Care, start suggesting about putting together a network in your local area of people either sourcing or delivering that training to see whether you can bring the cost down for providers, because I think that's the way to go. I do think that's a model that we should be using. I'm still thinking on the competency assessment side. I'm actually thinking in my head whether we can put together some competency guidance, Mark, free to download on the website for people. But I'm still struggling to get my head around the actual delivery of the training first. But anything we can provide as the Care in View to support people, we will do. Yeah, Mark?
Yeah, no, absolutely. More than happy to pull something together if there's a need. Do let us know. I think we touched earlier around mapping and action planning. I think the only other thing is speak to your staff around how they feel, because actually you might have staff that have done some of e-learning that you're already offering, and you might not be able to offer it right now, and thinking about your action plan for, CQC and why you're doing it. But there might be some staff that have done some training with you, still don't feel confident, and you can really start to focus on those staff. Just because the last thing you want is a CQC inspector to come in and you've got your plan of action of what you're going to do. You've started doing the e-learning for the tier one part, and then they speak to a staff member, or you have a PANS inspection, and they speak to a staff member who says, I have no idea what I'm doing because it's all going to go down the Swanee. And my only other bit, I've got two, but the other bit is, Jenny spoke about it earlier, in order to claim the funding, you've got to have a adult social care workforce data set. So if you haven't got an account, get one and get compliant. they're not as laborious as they used to be, so you can get compliant a lot quicker than you used to be able to.
The reason
And
I'm dying is my LDSS is locked and I can't access it, and it's an absolute nightmare because it's in beta mode and I can't do anything about it. No one can help me, so I don't have any funding at this moment in time, which is driving me mad.
And my last bit of advice is, we've got two people here, Elaine, Jenny, who are far more knowledgeable, and we try and only have guests on to join us that are approachable, that have the wisdom, and I know Jenny and Elaine will be more than happy if you want to reach out to them, via LinkedIn. Their companies are on Facebook, guys, I don't know, I'll share your websites in the chat if I can find my little thing. Here you go. Don't know if you want to expand on that.
Can I just share one more thing? And it's actually it's something I meant to make people aware of earlier. Skills for Care are doing a webinar around this on Thursday, the 13th of November. It's from 2:30 till 4 in the afternoon. So it's not for a little while yet, but it's always good to have a look and see what they're doing. So I think that might be a useful thing to do as well.
Can I go back and change my answer?
Yeah, go.
I feel like I'm being reactive here. Be proactive. Put together a 12-month plan. That's what you should do tomorrow. Go into work tomorrow, look at what you currently provide, and plan. Plan the next 12 months. It was something you said, Mark, about showing what you're actually doing. But actually, we do need to start planning this. So plan what you want to do, how you're going to get there, what you need to do about it. One last thing. Paula, you said I have... no, not that one. This one. You raise important questions that need to be discussed with the DHSC. My therapist also thinks I have ADHD and I speak a lot and I don't remember what I've said. So please remind me what those questions were. And I'm happy to go raising them with people. Is what it is. But it's we only speak the truth here on. Well, I only speak the truth here on the Caring View. I've got no filter. Mark has to take me off sometimes. I think this has been. Oh, Paula wants to know who is specifically hosting this meeting from Skills for Care. Do we know?
I'm just on the Skills for Care page now and just running through it. I can't see actually who is specifically hosting it, but I have got the link. Am I able to add the link to the chat box?
You can have it private and we can post it, definitely.
Perfect. If I pop it in there now, if you guys can share the link.
Yeah, I've got...
Mark, text Jane. Text Jane. See what Jane says.
I will.
So I just wanted to respond to Philippa's message in the chat. Do you need an NHS email to complete?
Oh, yes.
The NHS? No, you don't. And your own email is fine. You just sign up, and it's a free account that you can get for it. And I think Siobhan had put that you were interested in somebody had put they were interested in some of their young people being involved. And certainly if Mark or Adam can put my phone number in the chat, I'll be more than happy to pick up a conversation with you tomorrow in relation to that.
I would say,
yes.
Actually, I don't want to put your phone number in the chat because we're available all over YouTube, and then you'll be getting all sorts of people contacting you. But I think if you are interested in anything we have spoken about tonight around Oliver McGowan, whether that be accessing resources, figuring out how to get Tier 1, Parts 1 and 2, or Tier 2 training, or wanting to be involved in delivering the training, or wanting to just know a little bit more from any of our guests tonight, drop us your email, tell us that you consent to share it, and we will link you in with both Jenny and Elaine, and you can have your conversations and you can make magic happen. Because I think this is what it's all about: sharing, caring. What are we all about, Mark? Elevating, educating, and celebrating all things social care.
That's it.
I think this has been really, really... I'm not going to lie. I thought tonight was not going to be as brain-wearing as it has been. I've come away from this show tonight thinking, right, I have not got enough time. I'm being told that I'm probably heading towards burnout and I need to take a week off. But how can I use that week off? I'm going to take a week off and try and do stuff on this. Now, I do need to rest and relax. But I do think there is so much we can do here that it just doesn't feel like it's been communicated in the best way to social care from DHSC, from whoever. It just doesn't feel like it's been brought the same way. Whereas I think once you start breaking it down and thinking about it in our normal terms, it's a case of like, well, actually, this is really achievable. And this is great. Yeah, we're fragmented, but we all get along like a house on fire. So let's try and get this working. I think really, really interesting. We will make this available on our podcast as well for people to listen back to. Just fast forward all of my rants. That'll be absolutely fine. And you'll miss out on the website. So come and watch us on YouTube anyway, so you can get the websites there. Look, I'm going to draw us to a close because it's an hour and a half and Bake Off tonight. So I need to go and watch that and figure out what's going on there. But Jenny, Elaine, thank you so much for your time this evening. You're both more than welcome back on the show as much as possible. No doubt you're going to be inundated now with people asking you all around the Oliver McGowan training. And I think I'm going to be one of them because I'm going to need some advice on what I'm going to be planning moving forwards. And Mark and I will have a look at making resources available if we can on our website, making them accessible for people. I know some people have come up in the chat saying, yes, some guidance on competency assessments and how to go around them would be good. I'm sure we can have conversations maybe with our fabulous guests around what sort of guidance we can give out to people to sort of get you on that right path moving forwards. We will have a look at people who are providing and whether they want to say on our website that they're happy to support. We're not there just going to be selling people's training, but people who are willing to support with that. And I'm actually going to go one step further and say, if anyone's out there and thinking, actually, I'm Mr. Moneybags and I've got some funding available that I'd like to be able to support, let us know as well, because if we can put something together for providers, more than happy to. I want to do everything now. I want to do everything to make this work. Thank you, everyone in the chat, everyone who's been listening and watching tonight. Thank you so much, Paula, for your input and your comments. It has been a pleasure having you on with the show. I hope we've done Oliver McGowan justice tonight, and I hope we can continue to do him justice with our approach in this in social care moving forwards. Do go check out One Stop Training. Do check out CB Associate Training. Check out any of our sponsors that we've mentioned tonight, and also www.thecaringview.co.uk. Mark, very quickly, what we're doing next week? Do we have one next week?
We do have one next week. It's not it's definitely not set up yet, but I will be setting it up probably either tonight or tomorrow, but I'm not going to lie, I have no idea what it's on.
It's weird because it's the care show next week, and I don't feel like it's got the buzz it normally does. Sue me for saying that, but I don't feel like it's got the buzz it normally does, because usually we're like, no, we have to have an everything shower the day before the care show. We need to be shaved, we need to be waxed, we need to do our eyebrows, can't do a show. You're not even going. I feel abandoned.
No, I am going to the HET show in London. So if there's anybody down south that doesn't want to go up north for the care show, the HET show is a digital show. So yeah, right up my street with AI and technology and everything else. So yeah.
Wonderful. Well, thank you, everybody. Catch us next Tuesday at 7:30 for whatever we are going to be talking about then. But until then, check everything out on our website, rewatch this back, and get thinking about Oliver McGowan. How can you get this training delivered most cost effectively and efficiently and also respectfully for your services? So until then, take care, and we will see you next week.
See you later.